Hello again, and welcome to hashtag Our Doc Talk with NorthBay Healthcare. Our apologies for the interruption in the rebroadcast. I'm Robin Miller, social media and online specialist with NorthBay. Our guest today is Dr. Amber Stirlen. She's a clinical psychologist who's been with NorthBay for 6 years. Now, the way this format is going to work is that you can type your questions in live as it is streaming, or you can always email them to me at robin.miller@northbay.org. Dr. Stirlen is a clinical psychologist who earned her degree from Nova Southeastern University at Fort Lauderdale, Florida. And she's a member of the American Psychological Association and the California Psychological Association, and has experience in disaster counseling. She's been with NorthBay for 6 years. And Dr. Stirlen, we want to thank you for taking the time to be here and answer questions today. She's going to be discussing and answering questions about mental health issues and concerns in the wake of the recent devastating fires that have scorched portions of Sonoma, Napa, and Solano counties. Welcome, Dr. Stirlen, and thank you for taking time to have this conversation with us. Sorry.
That's okay. Thank you for having me. I'm glad that I could address the community in this type of forum.
So let's talk a little bit about your experience with disaster counseling. We understand you experienced this fire firsthand. You had to be evacuated. Tell us a little bit about that.
Yes, that's correct. I live right here in the Green Valley area, and the fires made it within about a mile of our home. So it was definitely a challenging experience with young children, and we had to move very quickly. We had smoke coming into our home early Tuesday morning that was starting to become heavier and difficult to breathe, and so we decided to go ahead and evacuate early in the morning on Tuesday, stayed with some friends further south, but then the air quality was pretty poor there, so we decided to keep moving to get the kids out of the air. And we stayed evacuated for about 4 nights and returned on Saturday when we got word that it was clear to come back.
Now, you also have experience counseling with the Red Cross following some disasters, hurricanes, and that sort of thing. Please tell us a little bit about that.
Right, so in my time working in South Florida, we had experienced Hurricane Katrina and Wilma, and we had evacuees who were there, and so I volunteered time with the Red Cross as a disaster mental health counselor and provided some services there at shelters to people. And the first thing really is to know that one of the biggest parts of responding to a disaster or something like the wildfires is providing support and listening. Whether it's going with family and friends and talking and surrounding yourself with good support is really the first and foremost thing that I could recommend.
But a hurricane is very different from a fire, obviously. So are people going to experience the same level or the same types of concerns after a wildfire and an evacuation that you would see in a hurricane?
So there are some similarities and some differences. With a hurricane, you tend to get warning, right? The news broadcasts when it's coming. Certainly some of the people in Northern California, like my family, we were lucky that we could get some warning. We could be a part of the NIXL alerts where we could get constant updates letting us know if the evacuation was advisory or if it was mandatory. However, some of the people in the area, such as Santa Rosa, may not have gotten warning that the fires did reach their homes with very, very little to no warning whatsoever. So there are some similarities as far as some people may have getting warning to leave and evacuate and others not. But some of the differences might be that, some of the similarities also might include that you're talking about something that's life-threatening. So both hurricanes and other natural disasters are both things that can threaten your livelihood, your children, your safety, your well-being, your future, the predictability of things. And so those are all similarities that people, when they're responding to a disaster, might share.
So what are some of the typical things that people might be feeling or going through in the wake of a devastating fire like this?
Okay, that's a good question. What are some similarities that people are feeling and thinking? So there's a lot of fear and worry and concern, and I found myself as well as a parent, wondering, worrying, were we going to have a home to come back to? And then in the coming days, as the fire was getting closer and closer, you might see more signs of anxiety, both adults and children and teenagers as schools were closing, and the unpredictability certainly sets people off to think, what's going to happen next. Even though we have access to news, social media doesn't necessarily assist us with healthy coping, because there's a lot of false information that gets put on the internet, which can exacerbate people's anxiety and worry response. But yes, sometimes feelings of worry, about the future, about now, about their homes, about friends, family members, those are all pretty common.
Can potential health impacts from the fire add to the issue? We had a question submitted in advance in our chat from someone who described a persistent cough among family members, sore throats, headaches, colorful phlegm, that sort of thing. And that's probably something they need to go see their primary care physician about. But does the concern of your health also add to the mental health concerns?
Sure, our mental and medical well-being are all interconnected, and what I can say about that is, first and foremost, certainly check with your physician if you have medical concerns. But if you had some pre-existing health issues and then you experience a traumatic event like the wildfires, or you're under significant stress, especially a long period of time of stress, whether that's a week, 2 weeks, or longer, then that can lower your immunity and cause a stress reaction within your body that can make it harder for you to get better. So, they can go hand in hand, but stress can exacerbate already pre-existing conditions, both medically and mental health pre-existing conditions like depression, anxiety, or PTSD, post-traumatic stress disorder.
And can media coverage add to it as well?
Okay, so media coverage is an interesting topic, and there will be some links that we'll be posting later that will talk about that specifically, as it should be age appropriate for children and adults. But as I mentioned, not everything on the internet is accurate, and so that can certainly exacerbate people's response to the wildfires, increasing anxiety, worry, that may not be warranted to what is actually happening. And again, I would recommend in general just limiting. People who I see in my office who have more anxiety and fears are the people who are on their phones or watching the news repeat over and over all day and all night. So a recommendation that I could make is to try and refrain, especially at this period where we are today, nearly a week out, if you're not exactly in the areas of smoke and fire, is to try and refrain and limit some time that you have watching the coverage, that you can check in from time to time to see what's happening and be up to date, but I would refrain from watching it all day and all night.
We had a question submitted. I assume that many involved in the wildfires will have a type of PTSD, or post-traumatic stress disorder, following this disaster, especially once all of the quote-unquote excitement wears off. How does one deal with that? And what's the best way to deal with the sound of sirens, fire trucks, or even the smell of wildfire smoke?
Okay, so this brings up a good question, and it's got a lot to it here. So I'll try and address them piece by piece. So first, I just want to give the general information that there are what we consider circles of vulnerability. So in the first circle, the people who are the closest geographically to the fires. The second being psychosocial proximity to the fires. So those who have lost a loved one in the fire, or lost a home or a business. And third circle of vulnerability would be people with a past trauma history. So if you lost a favorite family member in the past month, or a favorite pet, something like that, or some other type of trauma in your history, those people would be at most risk. So the mass majority of people, if we look at 60, 20, 20 being percentages, 60% of people should fare well and bounce back and be resilient with all the stuff that's going on with the wildfires. 20% might have minor symptoms, lasting a little bit longer than a month or several months, and maybe 20% might have more intense symptoms needing additional follow-up. such as what's mentioned here, post-traumatic stress disorder. So in the question it said, many people will have PTSD-like symptoms, and that's not necessarily the case. I want to actually give positive information out there that most will do just fine with the wildfires. You might yourself, it's normal to feel anxious and worried, but over the course of time, those things should settle down and you should get back to a sense of normalcy. If you're having further symptoms, like you are avoiding areas that were burned, or you're jumpy or irritable or nervous when you hear sirens and those sorts of things, you're not able to focus and concentrate, you're overeating or undereating, or really seeing changes in your sleep patterns, those would be some additional warning signs. If you're unable to function at work or school, or take care of your household and family responsibilities, those would be some more significant things to look for and warning signs that you would want to reach out to a mental health provider or your physician to have further follow-up.
I was going to ask you, well, how do you tell when it's moved from just a normal sort of reaction to something that's a little more serious? And it's when it starts to interrupt with your ability to function.
Right. Sure, yes. We really look at it disrupting your life and not being able to handle your daily activities of living. Those would be, some more serious signs and symptoms.
Okay. Are some people just naturally more resilient to these type of things, and why?
Yes, there's a combination of factors that make people resilient, but some of the things that we know are having a healthy, supportive social network can be very useful. We want to encourage people to rely on past coping skills. So everyone has experienced some type of stress, some type of loss in their family, difficult situation, and it would be useful to call upon those same coping strategies now. And healthy coping mechanisms would be things like getting exercise, maintaining a healthy diet, getting adequate sleep. Taking care of yourself is really important, and reaching out to others, socializing, having a positive attitude, positive thoughts, and showing gratitude has been linked to happier people. And so, whether you were a pessimist before or an optimist before, people who are optimistic tend to fare better and are more hopeful about the future, especially in an incident like a wildfire where you're uncertain about, will this happen again? Will it reach my house so close nearby? So there are some differences just in people's temperament of how well they cope and how resilient they are. However, as I mentioned, most people will tend to do okay after the fires.
Now, you mentioned exercise and reaching out to others. Are there other tips you have for people who maybe are feeling this anxiety, ways to ease that anxiety and ease their stress level?
Sure. I would urge people to reach out to family or friends or your church. Church can be a really great avenue for people to rely on as faith to comfort. And so having open communication and dialogue. If there were issues in the family, like marital discord or family tensions, something like a natural disaster can exacerbate those things. So it's important to keep lines of communication open and talk about it and offer conversations, particularly to kids, to talk about it. Ask them what they're thinking. Let them lead the conversation. It's best to give less information and let them lead by asking, what are they thinking about? What are they concerned about? What are they worried about? And then you can address their fears and concerns that way. Some people cope by not talking about things, and other people cope by wanting to talk about things. So having an understanding that we all express and cope with fears and anxiety differently, to be understood, and to know and to have a judgmental attitude of having a variation of emotions in yourself.
So let's talk about children. A lot of what we're talking about right now is how would an adult recognize their issues are going on and that sort of thing. But what about children? Are they going to display the same exact kind of reactions as adults? Is it different for them? How do you know if your children are having a problem?
So younger children tend to exhibit anxiety and stress through physiological symptoms, things like headaches, body aches, saying that they don't feel good. Those would be common. And so, I would recommend just giving them extra snuggles and attention, and you may see things like some regressive behaviors where children might go back to bedwetting even though they're potty trained, or have some outburst anger, have more emotions that they're expressing, be more clingy, want more time with you, and it's okay in a short period of time. Most of those things will be temporary. So as a parent, it's important to be mindful of those things and to still provide positive reassurance. And structure can be really valuable for children of any age, really, and for adults as well. Creating structure gives people the sense of normalcy, so being really specific and goal-oriented as far as the day, giving a task for a child to choose something, whether it's putting on an outfit, what they get to wear for the day, or picking what's for dinner, empowering the child to feel like they have a sense of control, can be really important and powerful for children. And then giving positive praise to children to make them feel positive. But as far as just symptoms in general, children and teenagers, young adults can express things in a variety of different ways, but teenagers, older, can experience things similar to adults and say that they feel down or they're worried or very concerned about things and feel anxious. However, younger children, elementary school age children, are less likely to verbalize, I'm not feeling well because of the fires, or I feel anxious or tense. So it may have parents be a little bit more attuned to some of the physiological expressions, as I mentioned, feeling body aches or pains.
I noticed one of the documents you sent us in advance, and we'll be posting it later, had some tips for how to help children through, and a lot of it was playing games and spending time with them. Is that pretty important in terms of helping them cope?
Sure. So getting to a routine is important, and part of the links might have some information about what you can do when you are evacuated, but some of the links will be addressed of what to do after an evacuation or after dealing with a natural disaster. So again, I really repeat and go back to getting back to a routine, a sense of structure, a schedule can be really helpful in communicating that to your children, because we as adults can kind of plan things out in our head that make us feel safe and secure, that we're going to be returning home on Saturday, and that we're going to clean up the house, and then we're going to go to the grocery store and do all of these things step by step. But children don't get that same choice, and so it can be really empowering to let them know, okay, here's the game plan for today. We're going to get up, have breakfast, and we're going to go to the museum for a little while so you can be inside away from the smoke and play, and then you get to pick what we're going to eat for lunch, and then we're going to come home and relax for the afternoon. It doesn't have to be a very complex schedule, but verbalizing that to children can be really important. Having a positive outlook and sense of humor can be a great thing for children. Children are looking to their parents and other adults and how to respond to the fires, and so if you take good care of yourself and exhibit positive, healthy coping, your children will follow suit. And so it's important for parents and adults to be mindful of what you're sharing and how you're communicating with other adults when there are children in the room, because it is common for us as adults to want to talk through things as well, share our experiences, but children don't get the same filter, and so things that you might say might come across in their heads differently. And so to try and refrain from watching the news in front of young children and talking about fires or damages or high levels of fear would be beneficial to remove your children from. And if you are having a challenging time and need to break down or cry, I would recommend trying to do that away from your children. Again, they want to rely on you and look to you as a sense of support, that you have things under control, and they will then end up coping better.
Do you have to be on tiptoes around them? I mean,
no, not
what
on
do you
tiptoes.
say that might be misinterpreted?
Well, here's an example that it could be said, hey, I'm going to go fight the fires, as a joke or in passing to the child. However, that could be really misinterpreted as in context of you're literally going to go fight the fires and fear and worry of a parent or an adult's safety, rather than a joke that we're going to go fight the fires and put it out so that we can all be safe. So not to tiptoe around children, but I think the main point is to not flood them with a lot of information, because they don't know how to process it and understand it in the same context that we do. And that goes to things like 9/11 or other disasters where people were replaying the news and replaying. As adults, it is a way for us to integrate information and make it part of our new sense of reality. However, children can misinterpret that greatly, and they can think that the event is happening over and over and over again. They don't understand that the event is over and today is a different day, and maybe most of the fires are out and that we're safe. But if they keep seeing the same news video coverage or people still talking about the current fires, they might have the sense that it's still happening right now. So a part of it is just limiting information to children, but as adults it's very healthy to talk through it with other adults and people.
Is there an amount of time that you can expect for children or adults for things to feel like they're getting back to normal?
It's a complex question because everybody, as we mentioned, everybody copes differently, and so luckily for our family, it really feels like we're mostly back in the swing of things. I have an almost 4-year-old and an 18-month-old, and so their understanding of what's going on is quite different. But at about 4 years old, my daughter seems to feel like things are fairly back to normal. She still has questions about the fires and safety, as she does hear us talking about what's happening at a limited level. So yeah, it might take weeks, and depending on how close the fires were to your house, or if you lost loved ones, again reminding you of the circles of vulnerability. The closer you were to the fire, if you had loved ones who were there or experienced things directly, or you have a past trauma history, including children who have had a past trauma history, somebody would be at most risk for coping with this if they themselves were in Santa Rosa, lost their house, and had a prior history of trauma. That person we would want to be on the lookout for to have difficulty adjusting to this situation. But for the most part, I would see in about a month, most people should feel like things are back together. Again, barring that you didn't lose your home and are still evacuated.
We had somebody on here who said, great point, that structure creates a sense of normalcy. And what's involved in creating that structure? Do you just pretend like nothing happened? Do you?
So I wouldn't pretend that nothing happened. I think it's important to give facts and to be honest with your children about what's going on. But I wouldn't make promises that you can't keep, such as everything's going to be fine or we get to go back home tomorrow, if that's not the case. Because there still may be some people who are evacuated in Santa Rosa and other areas. But creating structure could be something, if we think about kids, they tend to know their school schedule, right? We keep school on a schedule for a reason. It helps to give kids a sense of understanding of what's coming next, and their behaviors can be more contained. We can see outburst and irritability in children when they just don't know what's going to be happening next, especially, for example, my family who's at a hotel for 4 days in a row, and we had to actually move hotels once. So new hotels, different environment, different places to go, different places to eat. So just creating some normalcy and saying, okay, we're going to get up, have breakfast, we're going to have a snack at 10:30, then we're going to have lunch, then we're going to go play for an hour, and we're going to come home and take a bath. Just creating something that feels similar to your schedule before. So you might be in a different place with different things happening around you. However, I go back to communicating with your children, letting them know, here's the day, this is what it's going to look like, and you can empower them by giving them some choice in that day. Should we go to have pizza for dinner, or should we have Chinese food for dinner? Allowing them some choice, simple choices, or just creating something that they can understand what's coming next.
So what should someone do if they think they or someone else in their family is developing a more serious issue than they're able to cope with?
Okay, good question. As far as if you're not sure you're able to cope with what's going on, I would, first and foremost ask them to reach out to the person. And it's never harmful to say, hey, what's going on? I'm concerned about you. I've noticed these types of things or these types of behaviors. You've been crying more often or isolating. You haven't been going to work. You haven't, felt like you've been there. You've been kind of foggy or having difficulties with memory. What's happening, what's going on. So opening a conversation can be really helpful because people can feel lost and confused and not sure how to talk about it. And then beyond that, you can reach out to your physician or you can reach out to a mental health provider. People can go to their insurance companies to look for mental health providers who are contracted in their network. You can also look at www.psychologytoday.com as a good resource to look for counselors in your area. So those are some good avenues. But the overarching message is that most people should cope okay with the natural disasters.
We have a question posted. I have a friend whose toddler does not want to sleep in her crib since the fires. They were not evacuated, but were very close, and I believe the parents may have been in a stressed environment. Do you think an event like this can influence a toddler?
Yes, absolutely. It's not uncommon to see these types of behaviors. As I mentioned, the regressive behaviors, those could be things like being more clingy, wanting to stay more with your parents, or even sleep in their bed. So the recommendation that I have would be to normalize that that's okay and they should be temporary. Giving your children support and comfort, and that includes physical support, particularly at bedtime, tucking them in, maybe staying a little bit longer with them in these coming weeks, and giving them reassurance that if you are safe, to tell them that you're safe and your house is safe and that you're there to protect them. And if the toddler is sleeping in their bed, it depends on the parent's comfort level, but a recommendation could be that yes, it would be okay to have your toddler go ahead and stay with you for the next couple days or a week or so and continue to give them reassurance. And it's likely that it will return to normal in the coming weeks ahead.
It's hard for some people to admit that they're having an issue. Is it common for people to want to hide away or not share what's going on? And how do you deal with that?
So everybody copes differently. Some people do like to isolate and hide away, and others like to talk about it a lot. So I think it's important for us to recognize that we cope differently, but it would be more concerning if somebody is isolating more often and you start to see changes in their behaviors that are atypical. So again, if they're not attending to normal hygiene, they're not showering day after day, they're not wanting to get out of bed, they're not eating, they're not sleeping, things like that, major changes, those would be some more warning signs to say, hey, maybe we need to talk to a professional about this. But otherwise, people tend to cope differently, so that's probably more normal.
Is there something else that you wanted to make sure we touch on during this chat? Some issues that you wanted to make sure the community's aware of?
I really wanted to make this dynamic as far as what questions people had in the community. My experience with disaster mental health is to really create a forum where people can open that conversation and feel like they have some helpful tools and tips to help themselves, help family members, or have some protective factors in place for your children. And so really, I think that we've touched on a number of different things as far as resilience factors and who might be more at risk for developing further issues.
Also, what's the potential long-term impact on you in your general health if you don't try to deal with and talk with someone about these issues?
So this can be related to about anything. If you're having stress, if you had a death in the family, if you had a loss or some major event that you didn't talk about it, you didn't get help, and it's starting to affect you physiologically, certainly that could move further into something like anxiety or depression. But these things are very treatable. If you see your physician, psychiatrist, psychologist, a mental health provider, there is help out there to address these types of concerns. And so I would look at, in the coming months, if more than a month or after 6 weeks or so, if you don't feel like you're fairly back to normal, then that might be a time to reach out. It's better to reach out earlier than to wait 5 months where you've been feeling extreme anxiety, fears, concerns, avoiding situations, having flashbacks, nightmares, or things that we call intrusive thoughts, things that you can't get out of your mind that you think about all day. Those would be troublesome, and so I would extend that people would reach out to a healthcare provider for additional help.
And again, for those who maybe joined the conversation late, can you tell us again the kinds of signs of stress and anxiety that people should be keeping an eye out for in the weeks after these fires?
Sure. So for adults, some of this is related to children, but I'll touch on that again briefly. For adults, you would want to look for things like major changes in your sleep, whether you're oversleeping or you're not sleeping, you're you're having insomnia, you're having nightmares, difficulties with functioning with day-to-day activities like hygiene, not getting out of bed, not showering, not eating, or even overeating. Those would be concerning things. Isolating is a concern. You want to keep reaching out to people, talking about things if you need to. And resilience factors, things that you can do to be protective, is to have a positive outlook on things and being hopeful. Having a gratitude journal that you might share with loved ones or with your children. You know, what are things that you're grateful for every day, has been linked to healthier success and coping. You know, again, exercising, healthy diet, nutrition, and having a sense of humor about things can be all positive things. As far as children, things to look out for would be body aches, headaches, physiological symptoms that we know that they're not actually ill. I mean, it's different if your kid is sick, vomiting, having some other physiological symptoms. But if it's just a generic, you know, unwell feeling, body aches, pains, they might even say that they don't want to go back to school. If you find that your children are not functioning well in school, their grades start to drop, those would be some signs and signals that they're not coping as well, and you may want to talk to a school counselor or reach out to another mental health professional. But again, if after 6 weeks or so things don't feel normal, those would be the people to look out for, that maybe haven't adjusted as well. But otherwise, in these next coming weeks, everybody will have some form of, you know, potentially a little bit more anxiety than usual, because there are still fires that are live. But for the most part, I think people are starting to return back to normal.
How important is being patient during these weeks?
Sure, I think patience is a good thing, because everybody's off their schedule. You know, myself, even just being away from work and that environment, to get back on track can take a little bit of time. But being patient with yourself is important. Being patient with family members, your children, and even friends, because with all the distractions and changes happening, you know, it's easy to forget things that are on your usual routine. But again, as we start to get back into the swing of things, it should feel better.
And how important is it to be a role model to your children?
Very important. Children look to their parents and other caregivers and how they should be responding to the fires and what's happening. And so even if they don't understand exactly what's going on, if you're crying, if you're tearful, you know, if you're, let's say, acting out or having a challenging time, then your children may follow suit. They may start exhibiting those same things. So being cautious of that, being mindful. Again, I said, if you are struggling, reach out to other adults. It should be a one-way street where your children can confide in you and share all their anxieties and fears, but adults should really reach out to other adults for that type of support and not give all of that information to your children. So being a sense like you're a rock, you're the stable person in the family as a parent is really important, and that will help to your children adjust more quickly. One thing that I did want to touch upon is that I haven't mentioned is things like reaching for alcohol or other substances more often after disaster can be something to look out for, that we want to refrain from overusing alcohol or other drugs or substances to help calm our anxieties or fears, and to try and use the other healthy coping strategies like exercise and relaxation, taking a warm bath, getting out, watching a funny movie. Those would be healthier coping strategies.
I also read in some of the documents you gave us that this is not the time to make big life-altering decisions. Why?
Okay, so when under stress, and you know, I say whether you've won the lottery and it's a positive thing, or you know there's some devastation and you're going through a period of significant change and adjustment, neither of these times are a good time to make significant life decisions. I would give it, you know, a month or so before making any major changes, or possibly even longer than a month, until things start to feel like they've settled down, where you can clear your head a little bit and make those decisions if needed.
And again, for those who turned in late, sitting down and explaining to your children what they're hearing, because they're going to go to school and they're going to hear from other kids, and and that sort of thing. Any tips and advice for how to broach this subject with your children?
Sure. I think you touched on something as far as being patient, being understanding, open the lines of communication, have your child lead the conversation. You can ask questions like, what are you thinking about? What happened in school today? What are your friends talking about? What are your friends saying about the fires? Those open-ended questions rather than, something like, a closed-ended question would be, are you scared about the fires? Where they would say yes or no. It leaves less room for them to open up and create a conversation about it. So if you ask a more open-ended question like, what are you thinking about? Or what's concerning to you about the fires? The child might open up and say a little bit more. And again, then you have the leeway to give a little bit more information, factual information, or correct some information that they might have that one of their peers at school might have said. For teenagers, even 13, 17-year-olds or older who are in the household, they likely will be watching some of the news, which is okay. They can understand it, at their developmental level. But I would watch the news with them, so you can watch what their reaction is, how they're responding to it, and be able to just understand what they're seeing and viewing, and then again limit it so that they're not just on social media, because I know many teenagers today have their own phones and have access to live information on the internet. So being cautious about how much they're getting out there on social media and the news.
Our conversation has focused a lot on the aftermath. So you've been through this, and now what do you do? Are there things we can do in advance before we're dealing with the disaster that can help our children, our families, ourselves be in a position to be more resilient and able to handle these type of things?
Sure. I think that having positive coping skills can help with any type of situation that causes us stress. So even a move, family moving from one town to another and the children changing schools can cause a family a great deal of stress.
About what we can do. Sorry for the interruption. We're going to try this again and ask that last question on what parents can do and in advance to help children be ready in the event of a disaster, help them be more resilient, and help as adults be more resilient.
Yeah, I think with any major change or stressor in a family is trying to keep to a routine as best as possible. That always makes children feel more safe and secure and as if things are predictable. In the event of a wildfire or something like that, a natural disaster occurring again, certainly listening to the advisements. If you're told to evacuate, that it's important for you to evacuate and not to put yourself in harm's way. Involve your children in ways that's constructive. For example, you can have them pack a very small bag with telling them to pick out their blanket or a favorite stuffed animal and an outfit while you're busy packing other things. So it gives them something constructive to do, but also empowers them to be a part of it rather than them running around the house or being in every single thing that you're doing while you're trying to keep things in control. Certainly having safety mechanisms in place as far as a safety plan or an evacuation plan with your family in the future, knowing where all your documentation or memorabilia or things like that you want to take in the future would be helpful. There's a lot of other information I know out there as far as how to prepare things for your house, your homeowner's insurance, or what important documents to take. So I won't go into those types of details, but as far as how to prepare yourself is to, again, rely on healthy coping mechanisms for things that you have dealt with in the past.
Okay. Well, I think that's going to conclude our discussion because of the technical problems we're having here. We do want you